Lot of children are falling ill with vomiting, some amount of stomach ache, some amount of loose motions and fever, but the predominant complaint we are seeing quite often is vomitings. So what to do if your child has repeated vomitings? Any anti-vomiting syrup which you have at home, you can give to the child. Few things to keep in mind: when you are giving the syrup, don't give it with too much water, because sometimes what happens, because of the water only, the child may vomit out the syrup as well. Try to give the syrup without water, or just maybe a sip of water. That's it. After that, wait for a good 20 to 30 minutes before giving something to the child to eat or drink. Don't be in a hurry to feed the child. Let the medicine act. We are seeing children with just back to back vomiting, so just let the medicine act. Sometimes even the children are so nauseated that even with the syrup they'll end up vomiting. In that case, you can even ask your pediatrician for certain mouth dissolving tablets or certain mouth dissolving anti-vomiting strips. So they act faster and they don't go inside, so they don't trigger vomiting. Most of these kids with vomiting, what we are seeing is the vomitings are getting better, and then again after 1 or 2 days some vomiting is happening. That's because most of them are viral gastritis. They may need some antacid as well. So if your pediatrician has prescribed an antacid, please use it for the specified duration. Diet wise, if your child has vomiting, do not force feed the child. Many of these children are not having much of an appetite, so try to give them small portions and try to give them more of liquids: ORS, coconut water, buttermilk, rice kanji, sago water you can give. Avoid giving citrus fruit juices. They are more acidic and can make the vomiting worse in some cases. Watermelon juice is fine, but try to give more simple diet. Diet wise, also, you can give curd rice, idli, khichdi, banana, maybe some mashed potatoes. Very simple, easy to digest food you give these children for a period of the next 3 days, and then most of them are recovering. If your child has loose motions, then your pediatrician may prescribe probiotics and zinc, and in that case, giving actual WHO ORS is very important, and you try to give ORS after every loose stool. In case even with medicines your child has continuous vomitings, there is green color vomiting, child is very dull, not eating anything, not passing urine every 4 to 6 hours, there is blood in motion, the child is passing watery loose stools every 1 to 2 hours and is not taking that much ORS, in that case please immediately rush to the nearby emergency.